Question 1. A 40-year-old man presents with recurrent sinus infections, nasal crusting, hematuria, and cough with blood-tinged sputum. On examination, he has nasal septal perforation. Labs show elevated creatinine and active urinary sediment. Chest CT reveals bilateral cavitary lung nodules. Serology is positive for ANCA, PR3 ANCA. What is the most likely diagnosis? A. Granulomatosis with polyangiitis, GPA. B. Goodpasture syndrome. C. Microscopic polyangiitis. D. Eosinophilic granulomatosis with polyangiitis, EGPA. E. Sarcoidosis. A. Granulomatosis with polyangiitis, classic triad. Upper respiratory, sinusitis, nasal ulcers. Lower respiratory, nodules, hemoptysis. Renal, glomerulonephritis. Strongly associated with PR3 ANCA, CNCA. Why not the others? B. Goodpasture syndrome, pulmonary renal syndrome, but involves anti-GBM antibodies, no sinus involvement. C. Microscopic polyangiitis, no granulomas, associated with P-ANCA, not CNCA. D. EGPA, asthma and eosinophilia are hallmarks, also P-ANCA positive. E. Sarcoidosis, non-caseating granulomas, no ANCA involvement, or renal disease. Question 2. A 55-year-old man presents with chronic sinusitis, nasal ulceration, and hearing loss. He later develops hematuria and rising serum creatinine. Chest imaging shows nodular infiltrates with cavitation. Biopsy of the nasal mucosa shows necrotizing granulomatous inflammation and small vessel vasculitis. Which of the following lab results is most characteristic of this disease? A. Positive cytoplasmic ANCA anti-PR3. B. Positive paranuclear ANCA PA anti-MPO. C. Anti-dsDNA antibodies. D. Anti-glomerular basement membrane antibodies. E. Elevated serum IgA levels. Correct answer A. Positive cytoplasmic ANCA. GPA features necrotizing granulomas, ENT plus pulmonary's renal involvement, and is strongly associated with PR3 ANCA, CNCA. Why not the others? BPA, seen in microscopic polyangiitis and EGPA. C. Anti-dsDNA, specific for systemic lupus erythematosus. D. Anti-GBM, Goodpasture syndrome, affects lungs and kidneys without granulomas. E. Elevated IgA, seen in IgA nephropathy, not systemic vasculitis. Would you like a